Thank you, everybody. I'm Dr. Ben Weitz. This is the Functional Medicines Discussion Group of Santa Monica. I wanted to tell you about some of our future events. Next month is August 22nd. Dr. Howard Leibowitz is going to talk about male hormones. September 5th, Tom O'Brien is going to talk about autoimmune diseases. And September, so we're going to have 2 meetings next month because Tom O'Brien wanted to join one of our meetings, so we're accommodating him on the 5th. And then the 26th, September 26th, is going to be Felice Gersh talking about female hormones. And we want to thank Metagenics for sponsoring this meeting and providing this healthy food.
Yay.
Thank you, Metagenics.
Yay, Metagenics.
If you don't use Metagenics, consider it. Everybody who's here tonight, you can get a 20% discount off your next order for your Metagenics products. Please check out my Rational Wellness podcast on Apple Podcasts and YouTube, the video version. And recently had some great interviews with Allison Seebecker and Dr. Stephen Sandberg Lewis and Dr. Mark Pimentel and Dr. Chris Shade. So really high level stuff. So check it out. And tonight our topic is fertility with Denise Wiesner, acupuncturist, certified sex coach.
So many things.
So many things. And she's got a new book on called Conceiving with Love about fertility. And so thank you so much, Denise.
Thank you. I now know how to use this microphone. Hi. It's very interesting to talk into a microphone. And I'm really excited to be with you tonight and talk about one of my passionate subjects, which is fertility and actually intimacy. So tonight we're going to talk about, we're going to sort of weave in together some functional medicine. We're going to talk about some Chinese medicine because I'm an acupuncturist. We're going to look at things through the lens of the 5 elements. So if you're not familiar with that, you'll get a little crash course in the 5 elements. And then we're going to also talk a little bit about intimacy and sexuality, because it's one of those subjects that's really needed for fertility, and a lot of people don't know how to talk to their patients about that topic, so I decided to write a book on it and include that in the mix. So it's part of not just what vitamins you're taking and what herbs you're taking, but it's also like, are you having issues? And there's great resources to refer to if one is having issues, be it female or male, in the fertility department. And that's really about erections or pain with sex or just being pressured and having stress. So that's kind of what we're going to do today. And I won't make you do exercises because we're eating, so we're good, as I made another workshop too. So when we're talking about fertility and intimacy, we have to look at what the roadblocks are to this. And of course, we all know that stress is a huge one, really for everyone. And stress, when you're in the fight, flight, freeze response, you're not really going to make a baby. Like, did anyone feel the earthquake that we had? Yeah? Yeah. When it was not today. Like 2 weeks ago. 2 weeks ago there was an earthquake, and I happened to be in Mammoth, and I was in the earthquake like the day before, and I as I was driving up Mammoth, there was like the San Andreas Fault, you know, that's where the earthquake is on the right, you look at it, and I was like, gosh, I really hope while I'm in Mammoth there's not an earthquake in the San Andreas Fault. And when I got there, like turned evening, there was an earthquake, and it was the total freeze response. Like I was just stood there, like, what am I supposed to do? I'm supposed to go under a bed, you know, it's sort of, right? Do you have that? So I was thinking, like, if I was ovulating this night, it would be not the night to make a baby. I would not be like, hey honey, it's an earthquake, let's get busy. So stress gets in the way of baby making. It also, you know, reroutes the blood flow from the reproductive organs to the adrenal organs. So a lot of women who are stressed out and have high levels of anxiety usually don't have a lot of blood flow to their reproductive organs. And that's the blood flow to the follicles that contain the eggs that the woman's going to ovulate. And then, of course, it affects the hypothalamus, pituitary, adrenal, or ovarian adrenal axis, and it throws that off too. Fatigue is really important. I think I was just talking to somebody about like measuring fatigue and like what we do as functional medicine practitioners or acupuncturists to look at people who are fatigued. A lot of people are fatigued. Why? They don't sleep, right? They don't eat a good diet. They don't metabolize the nutrition from the foods they're eating because they have all these digestive problems or they have thyroid issues. And people are really too tired to make babies, as I find in my clinic. They're just too tired. Most people are like, we worked a long day, let's go to bed. And then babies don't go, and then they end up doing IVF, or maybe not. So fatigue is one. Health problems, lots of, you guys know all this, digestive issues, SIBO, irritable bowel. I have a patient right now who has 3 things. She has vulvodynia, she has irritable bowel, and she has interstitial cystitis. I don't think she's ever been touched. She actually has never been touched anywhere because it's so painful for her. So that impedes fertility, and they kind of all go together, right? Health medications. So recreational ones are really popular, right? I mean, I live in LA and I smell everywhere I go, there's like weed smell, right? And cannabis is not good for sperm. It slows them down. And although I know I grew up in the 60s and I know there were babies born and people who did, but it's not something that I tell patients to do. Like if their male partner is smoking a lot of weed, I tell them not to do that. And that's the correct term, says my son, who's 17. It's not pot, it's weed. So I know that now. And SSRIs, I know I interviewed Dr. Hyla Cass for my book about SSRIs because I have so many patients that are taking them, especially males, and sometimes it takes a lot of they can't ejaculate. It's a really long time for ejaculation for men on, some men on SSRIs, and women sometimes are not orgasmic on them as well. And so that sort of impedes the making a baby moment. As there's also the things like alcohol, which we know is probably not really great for fertility, and all other kind of medications. Body issues also impact fertility and intimacy, right? If you don't feel good in your body, which is a lot of people's, it's like one of the #1 issues for not only women, but also men, like how they feel about their body and being touched on their body, yeah? Like, women especially doing fertility hormones will like be bloated and not feel like they want to be touched, and it's about body image. Seems really important to help our patients feel good about what they have and who they are. And our environment is really not so good. There's a lot of toxins, as you all probably are. You're all practitioners, so you probably do detoxes and such, and measure toxins in our environment. They're very high, so educating patients on what they put on their face, what they put in their body. And then I took it a step further to talk a little about creating space for intimacy and fertility. So making like the bedroom, we'll talk more about that as we go on, making it a nice area without cell phones and computers and whatnot. And conditions that affect fertility, this could be, we can talk about these, each one could be an hour lecture. Endometriosis is huge. I see a lot of endometriosis patients. It affects people who have endometriomas, or blood-filled cysts on their ovaries. That gets in the way sometimes of ovulation. Women who have adenomyosis, which is endometriosis on their uterus. Their uterus is enlarged. That gets in the way of fertility, and it's an inflammatory response, and people have a difficult time getting pregnant when they have that. PCOS is really popular. I think I attended a lecture here on PCOS. It's the patients I see with polycystic ovarian syndrome in my practice are usually thin. They're thin and they don't have all this hair and acne that most have. So there's lots of different kinds of PCOS. It's very complicated and really important to work with patients to get their blood sugar regulated and get them out of this, instruct them what to eat and get their hormones balanced. And also acupuncture, really effective at bringing on ovulation for people who aren't ovulating. Electroacupuncture specifically can induce ovulation in amenorrhea PCOS patients. And also seeing young girls right now who are 25. Are you seeing this in your practice? 25-year-olds that have premature ovarian failure. They're just 25, not ovulating, not getting a period, and really high FSH, follicle stimulating hormone, which, if you don't know, is the hypothalamus sends this message to the pituitary to make follicle-stimulating hormone, that sends a message to the ovaries that says, hey, like make some follicles, and those follicles contain eggs, and then one is a dominant follicle and is released when a woman is ovulating, all right? And what happens as we age, like menopause, that FSH level goes higher and higher and higher. It's like the pituitary is screaming at the follicles to, come on, let's make an egg, let's make a follicle that contains an egg. So, but 25-year-olds shouldn't have that, right? And so I'm seeing a lot of like autoimmune diseases, maybe autoimmune high ovarian antibodies, and maybe hidden Lyme disease, and some reasons why women this young are not ovulating. Women have irregular menstruation for many reasons, and then there's vulvodynia that affects fertility if you really have a lot of pain. For men, low sperm count, morphology, shape of the sperm, and how they swim is important for fertility, and we're finding out more and more male factors happening, especially in older men. I just read a study where older men who if they had their sperm, they got their wives pregnant, the wives had an increased risk of having diseases, like preterm labor and such. I thought that was really interesting. So we're seeing older men, even though their sperm looks fine, may not be fine in terms of the genetic components of it. And that's where our antioxidants come into place. Varicocele, if you don't know, that's a varicose vein on the scrotum, and a lot of men have undiagnosed varicoceles, and you have to get it diagnosed by a doctor. And this can heat up the testicles and cause the sperm to have not good morphology. And there's things like, as an acupuncturist, I will give them blood movers that are herbs to help move the blood, and also have them put like cool packs. Like frozen peas. In fact, I think they make this thing called, is it ice balls? Something like you can buy ice packs that are specific for men's testicles that you put on to cool them down if they have a varicocele. And there's also surgery, which is like about a 50%. 50% it's good. If someone's older, it's probably not a good thing. If the wife is older. I'm seeing men that have unexplained, they don't have sperm, and the doctors don't know why. I'm seeing that a lot in my practice. I don't know if you guys do any fertility, but that's a big thing. Like, what's going on? They can't even tell why the guy's producing very, very little sperm. And what we can do with as an acupuncturist, and with herbs, and with nutrition and supplements, we can help them make some sperm, even if they have to take it out of their testicle. I work with lots of testicular cancer patients, and also men with low testosterone. So I'm seeing just a lot of male factor fertility. I just found that I think this Metagenics has this too. Is it this thing that has the?
Yes.
It has something that has a little chart that looks like mine that just explains to you, if you don't know about a cycle and what happens with hormones. This is talking about, you can see this follicle on the top, and it's going to be made, and follicle stimulating hormone, as I mentioned, is giving the message to make the follicle. And it's maturing, and it's containing an egg. A bunch of them are maturing, but one is a dominant follicle. And then it's ovulated, and on the top, and you can see the body temperature goes up about 0.4 to 1 degree. So this is a basal body temperature chart. And then at the same time, before it ovulates, high amounts of estradiol will signal the the pituitary to release luteinizing hormone that will finish up maturing the follicle, and then it will release it. And then the corpus luteum the yellow body will make progesterone, and that will keep the temperature high at the luteal phase, and that will also, you can see this, I should move, but this is down here is where the endometrium is, and it becomes more vascular. It's just like getting really cushy to hold hopefully a pregnancy. So that's just sort of a little idea of what happens here. So you can just sort of follow along with me if I use those big words. Okay, now I'm going to go to Chinese medicine, and this is the 5 elements. And why I love the 5 elements in Chinese medicine, if some of you are acupuncturists, is because we look at the whole body, mind, and spirit in each element. And so it's looking at the whole person as opposed to okay, this is their nutrition status, and then this is their emotional status. We sort of combine it all into one. And it's the same thing with functional medicine practitioners. You do the same. You're looking for what's going on in all their different systems that's out of whack, right? So what I love also about the 5 elements is that they're all connected. It's a circle of life. Everything's connected in our being, right? If we're upset about something, it affects something else. So let's do a little brief rundown. This is really brief, and it's sort of in line with fertility and intimacy, but about the elements. In my book, I have the earth element as a circle, the earth in the center. It's very Taoist, because the earth is our center, and we know that in functional medicine, you have to take care of digestion, right? You have to do, if someone's having bad digestion, everything else gets out of whack. The microbiome has to be good. So it has to do with digestion, but it also has to do with this idea of finding our center. And also, it opens to the mouth for digestion. And we'll talk more about like lover types too as I go on. The metal energy is about the lung and large intestine in Chinese medicine, and it's about letting go, like the breath, taking in and letting go. And it's about, it opens to the skin, so we can use that's what our skin breathes when we put stuff on it. It affects our body, right? We absorb through our skin. It also, there's the wood element, which is the liver and the gallbladder, and that's about how we detoxify. So this is like detoxification of hormones. Detoxification, maybe if a woman's gone through an IVF cycle and is given a lot of hormones, what do we do with all those hormones? Just like lots of estrogen, we have to detoxify. We have to help her body along with nutrition and all sorts of sweating, all sorts of things to help her detoxify. And then the wood energy also is about our passion, and it opens up to the eyes. So, connecting with your person with eye-to-eye contact is really, really important for not only intimacy, but for our wood energy. Water energy is reproduction, it's kidneys. It's kidney energy in Chinese medicine, but it's really about our sex hormones and our sex drive and all of that good, like let's make a baby and how our reproductive function's going. And that's also about fear, which is sort of interesting because women who are getting older are really scared that they will not be able to reproduce, and that doesn't help the water energies become more fertile. Fire energy it's about love, it's about heart connection. And in Chinese medicine, the heart opens to the brain, which is interesting. And we know from all these studies about the heart that it's our field, right? I'm connecting with your heart energy right now, all of yours, right? You're connecting with mine because we can feel our electromagnetic field around us. It extends, how far is it? I'm not sure, but it extends out from us. So connecting with your partner is about connecting the heart energies. And this is an important thing in Chinese medicine because there's an extra vessel that connects actually this fire, heart energy, with the reproductive organs, and also connects our water energy, our sex drive, with the reproductive organs. So really, our hearts and our reproductive organs are connected. So to make a baby with fertility, women come in and they're just like, oh my gosh, we have to have sex, and like we have to do this tonight, and like there's like void of like that intimacy that's really about making a baby in the first place. So I talked about a little bit here about what happens when we're under stress. Most of you probably know this, but just as for men who are under pressure to have an erection, I see this in my practice a lot. Don't get one. So it's like that sort of like we need to do baby making tonight. Oftentimes men will come in and they can't get it, and the woman's really frustrated, and it's a whole thing. They end up doing inseminations or IVF, and no one really addresses like the whole thing to begin with. And an ability to ejaculate. Some are so under pressure to ejaculate they don't. Could be lack of sex drive. It can go either way for men. Depression, inability to make sperm, resentment of partner, and of course we're generalizing, but I think if it's a man-woman relationship, men want to fix things and they feel really bad if they can't fix if something's happening with their partner, they can't make a baby. I see this all in my practice because the people talk to me about this, and they really have no one to talk to. It seems like they just don't have anyone, and they start telling me about all these problems, and I think it's just a lot of shame around fertility, infertility, and sexuality. So for women, there can be lack of sex drive, which we'll talk about later. For women, sex drive is a little bit, it's arousal and desire, and it's a little bit more complicated than we think. That all the women in my practice, 95%, check the box that says low sex drive. And I always wonder, like, that's so interesting. I wonder why that is. Like, do they really have low sex drive, or is there something else going on? So we'll talk about that. Sometimes it's inability to orgasm, which is another complicated thing for women, since women can fake it. Decrease in vaginal lubrication. We'll talk about lubrication a little more in detail and lubes that are out there. Since the hypothalamus is connected to the heart energies, and I said the heart energies are connected to our reproductive function, if a woman's under stress, oftentimes that energy will cut off and maybe she will have delayed ovulation. In fact, I just saw it with a patient of mine that came in the other day. She was taking the bar exam. She had really bad acne because she had PCOS, and she was given these really strong herbs by another acupuncturist to basically help with the acne, which is great, but it wouldn't be good for fertility. But she wanted to preserve her fertility. She wanted to ovulate, and she's, I've been working with her. She's been having somewhat regular ovulation, and all of a sudden her luteal phase, remember that second half that should always be about 12 to 14 days, all of a sudden became like 10 days, and she was really nervous and worried. And I was like, you're taking the bar in a week. Give yourself a break. That affects taking the bar, studying for the bar. That can affect our reproductive energies. It doesn't mean there's something desperately wrong with you. And I think that's important for us to put the whole person together. Withdrawal from life, anger, jealousy. Most of my patients that are struggling with fertility don't want to go to baby showers. They don't want to. They're really like, a lot of them start to isolate a lot and don't feel like interacting with anyone else because they just feel so bad, and so they really feel a lot of shame that they haven't been able to have a baby. It's a big thing. So I thought I'd just talk about some ways to manage stress that maybe you don't know. Obviously, there's adaptogenic herbs and things that we can take to manage stress, right, that help our body work with cortisol, and we can test patients' cortisol and see what's going on there and measure it. But in my experience of working a lot, I can tell when someone has elevated cortisol and when someone's cortisol is flatline, right? It's like when someone has elevated cortisol, they're anxious and they really have anxiety, and then when someone's flatline, they have no energy. That's probably when their cortisol is tanked. So meditation, yoga, and kissing is really interesting because kissing, there was a woman who wrote a book about kissing that said that men prefer sloppy kisses because they can see their women with a little bit of testosterone, which I thought was kind of fascinating. Yeah, so that's interesting. So kiss more. It also has all those good oxytocin and good hormones. So, my fertility patients, I'll be like, yeah, when's the last time you made out? And they look at me like, we don't kiss anymore. So it's a good thing to help your patients remember to kiss. I talk about reframing your experience. I do that a lot with patients because they get really negative, and really important for fertility when there's a lot of patience that is needed to live in the now, because people want to be pregnant yesterday. And sometimes it's not like taking an exam. It's something that even if you do everything perfect, it doesn't always work. Toning the vagus nerve. Vagus nerve is the 10th cranial nerve in your body, and it goes from brain to the heart, to the intestines, digestion, and then it also innervates the vagina, the cervix, and and uterus. And they've done studies that show that when women had spinal cord injuries, they were able to orgasm, and they think it's because of the vagus nerve. So that's important. And how we can work on the vagus nerve for calming is this point that acupuncturists call Shenmen, and it's in the ear. And has anyone had ear seeds in your ear? Yeah. So it's like in this little triangular fossa, and it's a point. I just wanted to point it out, where you can. I think they have like little crystal seeds now that you can buy. Really kind of cool and groovy. But you can actually put your finger and press on it, and it's a very calming. It sort of activates the vagus nerve. It's the innervation of that.
And Shenmen is the spot for the.
Shenmen is the name of it, and the spot is in the it's just I showed you. It's in the triangular fossa. But if you Google it, you will find lots of more specific locations of where Shenmen is. Something to think about. Let me get back. Breath work is important. I had a lot of practices I did with I just gave a lecture in Pasadena last weekend, and I had them like buzz like a bee, and I thought, maybe I'm not going to do that with this group here, but there's a bee buzzing exercise where you actually buzz like a bee. It's a yoga practice, and you can cover your ears and put your hands here and make the sound of buzzing like 4 or 5 rounds. Try that sometime. It's super effective and it really makes you feel great in your body. But at the end, if we have time and you want to buzz with me, we can do some bee buzzing. There's lots of other kinds of breath work to do that is good for helping relieve stress. I'll talk about some adaptogenic herbs in another slide. So managing fatigue, I think I'm going to, probably most of you have had all the lectures on SIBO, irritable bowel, right? Probably could give the lecture, all of you. So I'm not going to focus on that. I'm going to actually focus on the microbiome, because there's a microbiome not only in our intestines, but there's one on our skin, and there's one on our vagina, and there's one on our penis. And the vagina is really things that go up there. You know, we don't have it gets into our body just like rectal, like we do rectal suppositories, because it gets in quickly. So we don't have the acid in our mouth, in our vagina. So what you put up there, if patients are using things there for like lubricants, we want to be really careful. I learned so much about lubricants. I've talked to so many lubrication companies, and really the lubricants, a lot of lubricants have what's called high osmolality. And what that means is the reason you get wet is because it pulls out the fluid from your tissues, the water from your tissues, and dehydrates your tissues. And you don't know that because it's not on the label. So you have to be careful. I think you have to be careful what kind of lubricants, like things like probably like Astroglide had a really high osmolality, and it's best to use like it's best to use like sort of things like coconut oil. But for fertility, what happens in a woman's cycle is there's a place where she's ovulating and her cervical mucus becomes more like raw egg whites, and that's the fertile window, and that's when the pH of her vagina changes from acidic, less than like 4.4 down, and it gets higher. And so the FDA has approved a few lubricants. They have to be FDA approved to be used for fertility. One of them is pre-seed, and it contains parabens, and I don't think parabens are good. They're a preservative. So I don't advocate that my patients use pre-seed. But there's another thing called Baby Dance, and they don't have parabens, but it's not organic. And I think those are the two ones. There might be another one that's now FDA approved. So just put your patients, you want to know what they're putting there. It's kind of important. And also, you know about seeding, right? When woman's giving has a C-section, when a baby does not go through the vaginal canal and a woman has a C-section, then the microbiome that the baby picks up is the skin microbiome and not the vaginal microbiome. So there's something called seeding, which is basically people go in and they basically take like a swab of their vaginal flora and put it in the baby's mouth, and also put it on the baby's skin, so the baby gets the microbiome of the mother, which is like the hospitals aren't very happy about that. they don't want you to do that. But I think there's some like midwives that will help you do that, or help your patients do that.
The process is called what?
Seeding. Seeding. You can probably Google it. Yeah, so I thought it was really interesting, and I know some people who have done that. It's like I think they put it in a plastic bag before they got the C-section, so they had it ready to go. Spleen Chi diet is, we say it's a Spleen Chi diet, but like for fertility diet is mostly like things like right? Like no sugar, no, like low in wheat, low in refined products. And I started like looking at all these diets, like it's very specific. It's specific to the individual, right? And probably how many of you practice, right? You look at a person's blood test, blood chemistry, NutriSpec test, you just see what's going on and you give them the diet that's best for them. That's the right diet. It's not the same for everyone. A PCOS patient probably needs to be on a very low glycemic diet, right? And because you don't want them to have a lot of carbs. And I was starting to look up, like what's the best diet for fertility, looking at studies about ketogenic diet. And I have patients that are diabetic on ketogenic diet, and some people, I've had reproductive endocrinologists swear by that diet for PCOS patients and for themselves. And it's hard for me to say what the best one is. To me, it's like working with the individual. Would you agree? Yeah? If anyone has anything different, please let me know. I put sexy foods in my book because I think it's fun to cook with your partner, but also because like pumpkin seeds are really high in zinc, just like as in oysters are a natural aphrodisiac. They are. There's been research on them. And also chocolate. You know, chocolate contains PEA. It's like a little bliss hormone, like dark chocolate. So a little dark chocolate is really good. I happen to be looking at a reproductive site, like on a website, to see what like one of these REIs, reproductive endocrinologists, were advocating their patients eat for fertility and supplements they take, and actually one had dark chocolate because apparently it was like good for sperm. There was a study, it was good for sperm, and I was like, wow, that's pretty progressive of them, among other things. I thought I'd just talk a little bit about the Earth Lover. It's just the ideal Earth Lover type is really feeling good in your body, and it's feeling like nourishing, and you feel vital, because the definition for me of being fertile for a woman and a man is like feeling vital with energy and sleeping and feeling good and ready to make love to your partner, right? And so when you're not feeling those things, you're out of balance, and it can also lead to low self-esteem. And Earth types like to please other people, so oftentimes they want to please other people without regarding their own feelings. So communication is really important if there's an Earth imbalance. Metal energies is really about the mitochondria. The mitochondria is like a huge thing, right? Mitochondria, we inherit our mother's mitochondria. So what the woman, how her mitochondria function is, it's going to be passed down to her baby. That is true. And so we want her mitochondria. So coenzyme Q10 has been proven again and again, like 500 to 600 milligrams for women. And it's good for sperm as well, to be taking coenzyme Q10 and L-carnitine. In fact, Metagenics, when I met with them, just changed their prenatal, and it's called what's it? Plus one. And it now has L-carnitine in it, where it didn't have it in their other prenatals, because it really helps mitochondria function, which is very, very important. And it helps beta oxidation by transporting medium and long-chain fatty acids into the mitochondria. There you go. And acetyl L-carnitine, which I had to do my homework to remember the difference between L-carnitine and acetyl L-carnitine, is more of an antioxidant, and that's really important too. Obviously, toxins are not good. What we have, plastics and microwaving plastics and sort of cosmetics that we put on our body, and just really trying to help educate our patients about not only what they put in their body, but what they put on their body. Baby products. I just bought a new bed. It was like, it doesn't have flame retardant, it's organic, it's latex, all those things I'm sleeping on. I want to sleep on a good bed without chemicals. Cigarettes, obviously that's not good, but also something like Nicorette gum. I had a patient who chewed a lot of Nicorette gum, and he didn't tell his wife, and he couldn't get erections because Nicorette gum is nicotine, causes vasoconstriction. And then he was taking Cialis to get erections, and he was drinking alcohol. And finally we got him to the urologist, and he sort of started having microplaque in his penis. He's a heart disease. We can diagnose heart disease. A lot of urologists the first sign of heart disease is males who aren't getting erections. But also the nicotine wasn't really helping. So interesting. Smoking not good, neither is Nicorette gum. Not good for fertility, and it really messes with oxidation. Metal element is the animal nature. It's connecting with the breath.
Denise,
Yes.
you mentioned cannabis.
Yes.
What about THC? Do we know if that? What about CBD?
I was going to say that. CBD is not research. There's not a lot of research. Although I know anecdotally, I had a colleague of mine who was like selling multi-level CBD, and she was in her 40s, and she got pregnant. She was taking a lot of it, and she got pregnant, which I thought was really interesting. I can understand it's fatty acids. I can't say, there's no research saying yay or nay, so I sort of err on caution by not having it. But then there's sort of like, is the CBD beneficial with the THC? And I think we don't know. Does anyone have any other information on that? Yes.
THC suppresses testosterone.
Yes, THC definitely suppresses testosterone, but we're just talking CBD. We're just talking CBD only. I don't know about the CBD. Definitely what happens with THC and testosterone, it actually elevates it for the beginning, and then it crashes it, I've been told.
Guys I know who smoke a lot of weed after the
Yes, but they say that at the beginning it elevates your testosterone, and then after a while, I think I read a study that it crashes it, and it also creates slow swimmers. So it is not good for weed, and there's so much of it now, and people will use it as an aphrodisiac, but again, smoking too much of it, and then what's the amount? It's very complicated. So we talked about what we put in the body, but also removing electronics. There's studies that show that electronics are not good for sperm, right? Even just like cell phone usage, talking on cell phones. So I mean, it's the first thing I wonder if our electronics are getting in the way of male sperm counts, because I see them going down so much. Obviously the obvious one of putting a laptop on your testicles, heat on your testicles isn't good for sperm, but it's not just that. I think it's electronics. Plus, if everyone's on their cell phone, no one's having fun in the bedroom. So I really am a big advocate of no electronics in the bedroom. And there's also new studies about air quality and sperm, that air quality impacts sperm. I wonder how LA's doing. We don't have good air quality, but like HEPA filters and making sure that the bedroom is, that at least for the time you're sleeping, the air quality is somewhat okay. Nutrients, I think we're going to talk about that. Well, we'll talk about it later. Okay, wood energy is hormonal imbalance and detoxification. So that's the liver. And obviously we can balance the hormones. I mean, I have so many women with horrible PMS, young women, definitely hormonal balance. Everybody's like, and they diagnose themselves, I'm estrogen excess. Women are like, what is that? How'd you get that? Do you have that too? People are like, they read so much on the internet, they start telling me what they are. But I get a lot of women who really need to detoxify because they're doing IVF and they're on, or inseminations, or they're on a lot of follicle stimulating drugs, and those are not good. It's just really high levels of estrogen, I worry. And so I will put them on, afterwards, a liver detox. I do like the Metagenics Clear Change detox. It's really easy. I just send them, buy it as instructions. And it's a phase 1, phase 2 liver detox. I might add DIM into the mix for them to detoxify. The estrogen's very, very good. I know estrofactor is something I don't use, but probably wonderful also. And then they also, I know how, with PMS, I use the Chinese herbal formula, and they have a femme premenstrual with this Chinese formula called Free and Easy Wanderer, which is my favorite PMS formula ever. And then they add choline and taurine to it. So that's another way to help women deal with PMS. In terms of what energy type, I talked about eye gazing, I talked about fantasy play, and communication is really being important. The liver, the wood energy lover is like passionate and fantasy and trying to spice things up, as opposed to it's time, 7:30, we have to make a baby now. So you can use this at home tonight if you can, and just to share fantasies. People are so afraid about talking about what they want, and it could be something really stupid, I would really love you to look at me for 5 minutes, or it doesn't have to be these elaborate fantasies, but sometimes just bringing extra things in the bedroom, like rose petals. I did a little Instagram video today about roses, and because it's a Chinese herb, Megwei is a Chinese herb, roses you take internally, and it helps for calming, for anxiety, which is interesting, right? And also Megwei roses are great. There's rose oil to help regenerate vaginal tissue. So if you have a dry vaginal tissue, rose oil is a great way to plump up those tissues for women who can't take. It's not really fertility related, but women who can't, let's say they're menopausal and they can't take Biest cream or something. Rose oil is really good. And then those rose petals are great to touch your partner with. So 3 things for roses. It's my Instagram today. I had to share it here. This is the second to last, is the water element, which is really about sex drive and reproduction, and it's really what we work on for women. And the idea of getting out of the fight, flight, freeze mode using adaptogenic herbs. Ashwagandha has a lot of research on it. It's good for fertility and sex drive, and It's good also for helping calm the system. So it's actually used in a male fertility formula that just came out, developed by a urologist, and I'm going to go over the ingredients in that male fertility formula so you can see it. Chinese herbs, horny goat weed is, like the name implies, is used. As practitioners of Chinese medicine, we don't just give like horny goat weed as one herb. We usually use it in a combination of herbs together in a formula for libido. Maca is good. There's like 15 different types of maca. So there's for male, and there's for females, there's for premenstrual people, and there's for menopausal women. There's just a lot of different subtypes. So to use that. There's other herbs, mirepoix for sex drive.
Which maca is which?
I use a company that has them boxed with capsules, Feminescence, and they have them. Does anyone use that, Feminescence? And they have them. Yeah, they have them for like the premenopausal women because there's the yellow maca, the black maca, and when you're just getting maca powder at the store, I think you're getting yellow maca. So it's confusing. So I go to a company that just does it for me. For maca.
So which maca is the yellow maca?
I think the yellow maca is for males, and I think it's like an adaptogenic herb, and you can get it at the powder. You can add it to a shake.
Okay.
So it's probably good. It's good for you anyway, but it may not be the one that's specific for women and fertility, right? I mean, it's not going to hurt. I had a doctor who was really worried for her patient. She was concerned her patient was on maca. It was for menopause, and she was concerned that her estrogen was going to get too high, which I thought was really interesting. I didn't know that there was any big connection raising estrogen with maca. So, you can see those more here. This is men are neglected. I thought I'd talk about what can go into a men's prenatal. I know Metagenics has a male.
His synergy and then
I have it written down here. Men's Vitality. There's a packet that is great. I love their multi-packet for men. I think it's really good. And for men, even if they're trying not to get pregnant, it helps them. It's very easy to take, really good. And then they have stuff for I think I had it for libido. One more thing they have is something called Adrocet. Because cordyceps in Chinese medicine is an adrenal. It's good for adrenals and for stress. And it's also good for eggs and sperm. So oftentimes give cordyceps for women and they have a product that's cordyceps and it's got rhodiola and Asian ginseng. So it's good for adrenal glands, but also probably good for fertility if someone has high stress. Wellness Essentials and her synergy I thought was really interesting. It's B vitamins and fenugreek. It's said to improve sex drive. And I think I was looking at studies for that. I'm not sure fenugreek. I know it's just not conclusive about studies. It's good for lactation if you need to make more milk. Fenugreek is a go-to. All right. Okay, so here's the men's prenatal, and men are, if you give them these singly, they won't take them. Men like 4 pills and that's their max. I'm sorry, men. Would you take a lot of pills? Do you take a lot of pills? Yeah, you do. These are the exceptions here in the different groups. They do. You have to educate all the men on about taking supplements because my men are like, how many do I have to take? No, men are usually pretty motivated in my clinic, but this is just what goes into a men's prenatal. A vitamin C, about 1,000 milligrams. Vitamin D, obviously it's better to have it tested than to just be giving vitamin D randomly, like to know what a man's vitamin D is, but it's really important for sperm counts, motility, and morphology. And then there's L-carnitine, which is improving count as well as sperm. And I think I've lycopene twice, obviously types of beta-carotene. And these are studies, omega-3 ratios with omega-6, obviously more high on the omega-3 for fertility. Selenium with vitamin E helps increase sperm count and sperm morphology. CoQ10, same, we talked about that earlier. Pycnogenols are good, and zinc helps increase testosterone, motility, and count. And maca, because it's used for libido and erectile dysfunction. And another thing, studies done on astragalus, which is a Chinese herb that had improved motility when men were taking astragalus. And myo-inositol, which is used a lot. I use it for my PCOS patients, right? The dechiro-inositol and myo-inositol ratio. But this is inositol for men, so it's used because it's naturally occurring and present in high concentrations within the testicular tubules and is involved with sperm maturation, especially chromatin compaction. So good to have that involved. I know that that's in inositol is also in all the prenatals for metagenics. And then L-arginine or L-citrulline to increase nitric oxide production. We had an interesting talk earlier about nitric oxide and this idea that everybody wants to oxidize, but it's really important to sort of have the balance between oxidation because you need that for an erection. It's a nitric oxide pathway. And so men, like L-arginine increases blood flow, and I'll use that a lot if women aren't producing a good uterine lining because it's involved in nitric oxide. I'm not worried about the inflammatory. I want some inflammatory. I want inflammatory when they're ovulating because it's an inflammatory process. It's not all anti-inflammatory, yeah? So, when a woman's ovulating that little window, or if, like a man's trying to get erection, we want to sort of stay away from things like they'll say don't have Advil when you're ovulating because it's helps, it's an anti-inflammatory and you need some of that inflammation when you're ovulating. And we talked about that with going into labor. We had some really interesting conversations about women who were going into labor because they were having a lot of fish oils and it was preventing them from going into labor, which is a huge inflammatory process. You want to have that inflammatory to go into labor. So you don't want your women to take a ton of fish oils, like 4 to 6 weeks before they deliver, because you want them to start, having that process go. And apparently L-citrulline is okay for men as it's part of the L-arginine to give, but not for women. There's not enough research. So the water element type, it's kind of the idea about what gets in the way of having a sex drive. And part of it is just we have to slow down in our society. We're all moving so fast, myself included, right? That we just go, we don't ride the tide leisurely, we just are home, a lot on our mind. We don't take time to slow down. And so it's important for us to slow down and connect. And this is like what happens with arousal and desire, right? So you meet somebody, and that's when it's controlled by the neurotransmitters dopamine and serotonin and the hormone testosterone. Then you get to know them, and you have a lot of things going on in your brain, and you just can't get enough, you can't eat, you can't sleep, and you just want to be with this person all the time. And then time passes, and this goes away, and then you have to recreate this, right? And arousal for women takes about 20 to 45 minutes for all these erectile tissues to plump up. So I thought I would do a little diagram of the erectile tissues in a woman's body, because we don't get this, I know we don't get this, I didn't get this in acupuncture school, but there's the clitoris that goes, it's like a wishbone, so it's not just the tip of it, it's the whole thing. And there's also the vestibular bulbs, which plump up, and they're right under they're underneath in the vestibular area. And then there's the perineal sponge. So you can see it's so nice, they just make this whole nice round circle around the uterus to and they have to swell with blood, and that takes time. And it takes time for a woman to become aroused. It's hard for a woman to be, women who say I'm so dry, I'm not lubricated at all. Yeah, I have to ask them if it's a problem with their foreplay, or if it's a problem with, they don't produce because they've had maybe some kinds of medical procedures on their cervix, which will sometimes get in the way of producing lubrication. Because menopausal or not, women can produce cervical fluid. I mean, obviously if it's not in use, it shrinks, and if there's problems with pain, there's also problems, and the tissues do get, they don't have estrogen, they do kind of get dry, and there's all sorts of things that happen, but it does take time to lubricate. And that's important for us to have that conversation and educate our women about it, and our men. So lastly, we're going to talk about the fire element, which is about love. It's about our heart energies. It's about the hypothalamus, pituitary, ovarian axis. And it's about, also, heart has to do with insomnia and sleep, which is a huge factor. Today's discussion in my clinic was everyone was like, did you sleep? Did you sleep last night? Did you sleep last night? Because we had a whole conversation in my clinic because nobody slept last night. And it was just sort of this really interesting thing of nobody slept. Everybody had insomnia in my clinic last night. Sleep is a big issue. And I see do you see a lot of patients for insomnia? A lot, it's a huge issue. For sleep, not everybody can take melatonin, not everybody responds well to it. But for fertility, melatonin research has shown is good. You know, and that might just be like producing your own melatonin by having blackout curtains and whatnot, but you can take it. Or magnesium, you know, I have to get this Meta Relax. You need to get Meta Relax. Because it has magnesium and L-theanine, and I want that before I go to bed. Because I didn't sleep last night. So that would be a good product. But our Chinese herbs, there's like a lot of things for insomnia, but so important to sleep so that we can restore and repair, make our follicles, recharge our body. And I think these are like basic things, but super important. And lastly is this idea of doing the inner smile meditation. This is not last, second to last. It's inner smile meditation is a Taoist practice, and something that I have to remember to do too, but it's really, I'm just going to do it with you really quickly. So why don't we all close our eyes for a minute and just kind of, in your mind's eye, start scanning your body and smile to each of your organs. Like thanking them with gratitude for your stomach, for digesting this delicious food we had here tonight, feeling all the nice digestive enzymes working, processing the food, feel your heart beating and how amazing it is that it provides life to you. Down to your organs of your intestines, how they're working so beautifully to take the vitamins out and bring nutrition to your whole body. Thanking your reproductive organs for the hormones that they produce and how they function so beautifully, smiling at them. Wow, this is where life is formed. Even if you're in menopause or you're not making any more babies, life happened here. And any parts that you need to do a little smile to in your body, thanking your body for working, maybe your senses, your eyes, your mouth, your ears, your nose, allowing you to take in the world, smiling to your magnificent being that you are, and that even that got you into this room tonight. And when you're ready, you can open up your eyes. I love this meditation because everyone smiles. Like everyone has a little smile on their face. It's so beautiful. But these are the kinds of inner smile meditation that we can do with our patients to help them just appreciate what's here and now as opposed to what might be in the future, what didn't work in the past. So to be present in the moment. And there's one practice that I'll also do with my patients. It's a tapping meditation where I can teach it to you now, where just there's like all kinds of tapping, right? Tapping on a point called yin tongue, which is between your eyes. You can just tap it. And this is like, you can have this thing that's like, I am present in the moment. I am present in the moment. I am present in the moment. And then you can have them tap between their, like the breasts, which is the heart energy. It's a point in Chinese medicine. It's like, I am love. I am love. I am love. It's everyone's smiling still. It's so good. And then right here, like above your pubic bone, anywhere in this line, like the reproductive energies, I'm in my body. I am in my body. I am in my body, right? So much of the time we're here in our heads and not in the present moment. We're not in our love energy in our hearts and feeling like gratitude for what we've got. And then we're definitely not down here. Or, because we're all up here. So the idea of trying to bring up down here, but with this connection of love. And the fire energies also are about love and romance. It's about kissing, as the tongue opens to, in Chinese medicine, the tongue is an extension of the heart. So like deep, passionate kisses. And then what gets in the way of this oftentimes is forgiveness. Like if you're holding on to some resentments. So if there's some resentments, it gets in the way of fertility. And then there's practices like placing your hand on each other's hearts and just gazing into each other's eyes as a practice of connection and really connecting with your partner. And that's pretty much all about faith. Because in fertility, it's unlike sort of like if you go on a diet, you eat a certain amount of foods, then you'll lose 5 pounds and there's a cause and effect. Fertility is you do everything right. You eat the right foods, you do meditation, you connect with your partner, and let's see, you take blood tests, and you do a NutriSpec test, and you're exercising, you're doing yoga, and you're meditating, and you went on a retreat, and you're working with a therapist and a naturopath. I see these patients, and you're not getting pregnant, you're not conceiving. And sometimes it's just about kind of cultivating patience and faith. And that's hard, because for all of us, me too, I want it now. I want it instantaneous. But it takes time. And the idea for me, and one of the reasons I wrote this book, is to just get people back into love, because where there's love, there's life. And that, to me, sort of sums up the whole fertility journey, from vitamins and taking care of your body, to sleep, to nutrition, to like all of it, sort of this whole body approach to working with patients. So that's my presentation. Do you have any questions? Very quiet audience. Questions?
Oh, could you raise your hand? We'll bring you a microphone. Just so everybody else can hear.
For the IVF procedure that you just mentioned,
Maybe. Here.
No, we can't hear you. You can't hear you. Stand up.
For the detox procedure that you just mentioned, and for IVF, what was the medication or remedies that you before and after during the time?
For IVF?
Yeah.
So when someone's before they're doing IVF, let's start from the beginning. It's really to get them as health. It's like it takes about 3 months to get them prepared because of the growth phase of the follicle. So I like, if I can, I'd like to have 3 months with them at least to prepare them for IVF. And that time, I'm like, I want to nourish their follicles. I want to increase blood flow. I want to help I'm like, if they're toxic, if they're like, their liver's toxic, then I will put them on a detox. And oftentimes a detox is the best thing to do before IVF, yeah? Because they're just like, they need their body to be clean. That's like, that might be a clear change where, cutting out wheat, dairy, gluten, and using phase 1, phase 2 liver detoxification. Depends on the patient. Some patients don't need that. So you're sort of assessing who needs what. And then oftentimes if they're stressed, I might add adaptogenic herbs. I write custom formulas for them before to help with egg quality, acupuncture to help with blood flow. That's the sort of maybe detox part before. During the IVF, you definitely don't want to do liver detox because they're on a lot of hormones and you don't want to detoxify them faster. Like the doctors are going to be like, no, because you want to support their IVF process. And they're so loaded with hormones that I often they might take a prenatal, they'll take CoQ10. These are all things that are good for fertility. A lot of doctors will give DHEA for low ovarian reserve. So the women, they don't test it. It's like 75 milligrams of DHA. They'll just continue it on during an IVF cycle. Vitamin D has been implicated, so they'll take vitamin D, a fish oil. That's kind of like basically what they'll take, and maybe some will take more. And I'll do some Chinese herbs with patients if they're going through an IVF cycle. It depends on the doctor. A lot of doctors don't want you putting herbs with their hormones because there's not enough research showing so it depends on usually if they fail 2 IVFs, I will do herbs with them because they weren't successful. And sometimes it depends. There's autoimmune patients that need support, let's say they have Hashimoto's and they're doing a fertility cycle, which happens a lot, and their antibodies are super high, which happens a lot. And doctors don't always test thyroid antibodies. They just put them on thyroid medicine. And so like those kinds of the patients, I really want to get their antibodies down before they do an IVF. So like, it'll be glutathione, sometimes IV glutathione, which I don't do. We'll get down antibodies very quickly and I'll refer for that. Or, N-acetylcysteine might be something I'll use to increase, to help bring down their antibodies. Acupuncture, herbs, diet, but that's sort of what I'll do for autoantibodies. And then afterwards, if they do a freeze cycle where they freeze their embryos, I will, it's because usually a lot of IVFs now, they freeze the embryos, it's supposed to implant them back. I will then want to put them on a liver detox and I might add DIM to the equation because they have high levels of estrogen, right? You just want to leave them like, okay, we took out your eggs, good luck. And then these women have to they have like big bellies if they have a lot of eggs. And they're just left, right? And maybe their corpus luteums have been damaged, so maybe they don't produce as much progesterone, maybe they do, we don't know yet, and they just leave them. And so that's the time I'll really want to support them with like a phase 1, phase 2 liver detox.
What about some of the tricky, I don't know if this is working now, I think it's not. What about some of the tricky thyroid patients? Maybe they've been told their thyroid is normal, but do you ever have to do like a underarm temperature test to maybe get a better assessment if is your thyroid really working properly?
Thyroid is such a big issue for fertility patients because you have to have it. They like their TSH 2.5 or less. So most doctors, if your TSH is over 2.5, you are on medication. They put everyone. Maybe they don't really need the medication, but for fertility purposes, they don't look at underlying anything, and they just put them on. So you might have like someone who just had maybe they're not having enough iodine, and they don't have antibodies, or maybe their diet's not really good, and so their TSH is a little elevated, or maybe their adrenal glands aren't functioning really great right now, and so it's offsetting thyroid, and they're just doctors immediately put them on thyroid. So then you're having to deal with that. So it's not. I don't find that they're not medicating their patients. It's actually the opposite. People are medicating their patients.
And iodine deficiency is really common because a lot of people are not eating iodized salt anymore, and if they're not having seaweed, then a lot of times, you're not getting a lot of iodine.
Right, but then all of a sudden they're put on, you don't have a chance, sometimes you don't have a chance to work with them because they're immediately put on Synthroid. And then you're like, oh, because now you can't give iodine, right? So it's tricky, but if you can get those patients beforehand, work with them before they get to the IVF clinic and say, well, give me 3 months. Let's try to work with getting your TSH down and getting your T3, T4 by. Let me give you some supplements and nutrition. If you don't have Hashimoto's, then you have a better chance. And sometimes it's too late, but that's a great point.
How long is the liver detox?
You can do them. I just do like a 10-day. I just do a 10-day one because it's hard to do. I mean, I have a patient doing it right now who, basically, interesting enough, this patient went and did all this fertility, and what ended up happening is she had these canceled cycles. So she had this really big endometrium. It was so was hyperplasia in her endometrium, like really bad, that the doctor had to put her on like 6 weeks of progesterone. Or 3 months, it wasn't even 3 months of just progesterone because they were really worried about her uterine lining. So, but that was probably caused because of these high levels of estrogen from being on all these canceled cycles and having all these follicles, right? So it just was it was a mishap. And she said, so I just put her on a liver detox because I was like, let's just clean everything up because that seems to be the right thing to do. Now she's going to start another cycle. But yeah, so it's like 10 days, 14 days, depends on the person. Oh, you mean like in their cycle? That detox is a great question. I feel like the people that I work with are so busy that just getting them to start a detox is amazing. Because there's always well, we're going away on vacation here, and then we're going here, and it's it's never a good time to start a detox. So I just am beggars can't be choosers. I have them start whenever. But I'm sure there's, probably a detox. If they're not trying to get pregnant, it's interesting, in Chinese medicine, we do things more as the cycle goes. We do things with the cycle. So the follicular phase, the first half of the cycle, is this very nourishing time where we're nourishing eggs and we want to nourish the body. And then after ovulation, it's more like the progesterone phase would be the more of clearing phase in Chinese medicine. So as you're asking me this question, I'm thinking when would I really ideally like to give it? And I think it would be the best to give it after ovulation, and you like to more clean up, but that isn't how it always works. But yeah, that's a great question, thank you. Anything else? Great. Thank you so much.